Hey everybody, this is Jack's Wholeness. This is Morgan McGee.
This is Mary Alice Farina.
We're in Memphis at a conference. I thought this was a perfect opportunity to talk about what we do and what we see. The paradigm we're working on and we're shifting. Mary Alice, you were talking to me about the sweater analogy. I found this very interesting.
So one of the ways that I explain to my clients how the work that we do is different from a traditional massage approach, because I'm a massage therapist by licensure, is that if you imagine wearing a sweater and one of the fibers or the threads of the sweater is hung up on a nail and you move away from the nail, it's going to distort the shape of the sweater, and that's going to function how well you can move. If there's a lot of tension, for example, on a thread attaching to your arm, that's going to limit how your arm moves, which then may affect how you can move your trunk and those kinds of things. So other approaches to getting that thread off the nail might be, cut the thread, or let's give you a drug so you don't feel the effects of the nail pulling on the thread. But this work gathers up the fibers and brings the sweater to the nail so that it can just fall off. And so that's what we do with our hands. We support the body by bringing the restriction back to its source of restriction, and then the body knows what to do. It basically dissipates the restriction, and then the shape of the sweater is restored.
We could knock someone's legs together and then they can't walk away from the nail anymore. Or we could out-sew the tear in our clothing, or we could just bring the sweater and you back to the nail, pull the nail out, maybe the sweater goes back.
Well, one of the other great examples that Dee Ahern, one of the instructors at the Rawl Institute, gives is that if you just sit up straight and gather all the fabric underneath your shirt, underneath your right arm, and you pull on the side of the fabric so it's all held tight, and then you try and lift your right arm, you can't lift your right arm anymore. So I'll have my clients do that as well, and then they get it. It's like, oh, and so if those fibers are your liver, that's how it can affect the right arm.
What clients do you see coming through your office right now?
Because I'm in a military community, I do see a lot of active and retired military personnel. The active military personnel usually are referring, it's by word of mouth that they send each other, because this kind of work, especially the combination of neural manipulation and visceral manipulation, is really able to help bring about balance. So what active military can often experience is some form of anxiety or related kind of symptoms when they are not active duty. As one of my clients said, I go home, I sit on the couch, I watch Netflix, and I'm jumping out of my skin. I can't relax, I can't go to sleep. I go overseas and people are shooting at me and I sleep just fine. And so I just explained to him, if your nervous system is set up for the fight and flight and freeze response, and then you're in an environment where you're supposed to be in rest and digest, and you're stuck in that fight or flight mode, your nervous system doesn't know how to go back to that rest and digest. And so the way I explain the work to them is that I'm going to help show your nervous system that there's the other end of the continuum, and it's like a foreign country. You haven't been there very long, so the more times we get you to go to that rest and digest mode, the more comfortable you'll be there. That pathway becomes open and available to them, and usually after 2 or 3 treatments, the comments that I'll get is, I don't know what you do on the table, but I always fall asleep on your table, and then I go home and I sleep great, and now I'm sleeping on a regular basis. And so that's when they start referring their other friends who are having similar issues. And what's lovely about this is that they don't have to be on anxiety medication, which will affect their ability for rapid deployment, and it's not necessarily just a psychological issue. There may or may not be a psychological component to it, but I don't have to get involved in that, and then that doesn't affect their security clearance. So it's a win-win.
Yeah, this stuff doesn't affect your lifestyle. There's no giant lifestyle change. The effects are fairly immediate. Mm-hmm. Where are we in the industry right now? Because I'm fairly new to this industry. This is 3rd year for myself. I haven't been doing it that long. Where are we in terms of the industry? Are we moving forward? Are we
I think we're starting to reach a critical mass, because I teach at a community college, so I have massage therapy graduates, And just the other day, I had a recent graduate contact me and say, do you know anybody who does visceral massage? Because I have a yoga client who wants visceral massage. So the word is getting out there that this is a therapy, a modality that people can request. I think it's more common that cranial sacral therapy is getting requested, but the more, like I said, I think we're reaching critical mass and that people are aware, patients who've had positive results are spreading the word, and so now you're getting people who say, I think this is a visceral issue. I'm getting referrals from posture restorational PTs who get to their end range of their therapy and they're like, I think there's something else going on here. Why don't you see this visceral therapist? And that might take you to the next level. I had a really interesting referral from a PRI PT. She was doing, the patient's female, retired nurse. She was doing great with her postural restoration stuff, which was coming about as of knee replacement surgery. And then she told her PT, oh yeah, I'm not going to be in for the next 2 weeks because I'm having a hysterectomy. And her PT said, what do you mean you're having a hysterectomy? Like, I didn't even know you were doing this. And she said, well, yeah, according to the ultrasound, my uterus is sitting on my bladder. And that's why I can't tell that my bladder is full. And I only know it's full when I start to leak. And she was also having other symptoms, uncomfortable during intercourse and some other issues that she was aware of. And so she's like, we're just, I'm going to do a hysterectomy. We'll remove the uterus and then that'll take the weight off my bladder. And so she said, basically for the price of a massage, why don't you go see this visceral therapist? And if she can help you, great. And if not, you haven't really wasted that much money, and
Correct.
Maybe see if this surgery's not necessary. And so she came to see me, and it was really lovely to know because she had ultrasound confirmation of what was going on and other tests. And so it was great to kind of know from the Western medicine, having the imagery to kind of say what was going on. And then her general listening took me right to the uterus, and her local listening took me to the left side of the uterus, left fallopian tube, and then consequently to some of the attachments to the bladder.
I know where you're going with that one.
Yeah, so we treated that, and in the middle of the treatment, her eyes got really big, and she said, wow, there's something in the middle of my abdomen that wasn't there a minute ago, but I think it should have been there. And I said, that would probably be your uterus. I said, how's the pressure in your bladder? And she said, that feels pretty good. So did a couple follow-up treatments from there, which just was a little fine-tuning again on the urachus and other tissues in the area, making sure her pelvis and her sacrum were moving properly, those kinds of things. And she was good to go. I said to her, what's the follow-up with your surgery? She said, oh, I canceled that. So a really positive result there, and she's not having any of the symptomology anymore. So
that's a story with a great ending where a PT, right?
Yes.
Recommended something that she didn't do to somebody else.
Right.
That doesn't always happen in this industry. We're the best at what we do. Everyone else can lay an egg for all they care, because there's not a great financial incentive to do favors for other people. I don't want to be too cynical about this, but you know what I'm talking about out there, audience.
Oh, sure. But I think once you develop a good relationship with another therapist, the client was happy. She continues to do her PRI work with the therapist, so it wasn't an income loss to her at all. And of course, I've had client referrals from the that particular patient, and continue to get referrals from the PRI PTs. But I also refer to them. I have, a lot of sports clients who are golfers and et cetera, and I'll tell them, if you want to have a better analysis of what's going on with your posture and how well this works, these are the people who are particularly excellent at it, especially since they have a athletic trainer who really focuses on the biomechanics of golf.
Right.
Golfing is not a thing. Of the game of golf, and so the street goes both ways,
right.
and so it's a lovely relationship to have.
That's great. You're out of where?
I am in Aberdeen, North Carolina, which is in Moore County, which is about an hour south of Raleigh, North Carolina, and I teach at Sandhills Community College.
Excellent. People can get in touch with you how?
The best way is to text me because I'm usually treating my patients. So my phone number is 910-315-2174. and I work on human patients and on equine patients, which is horses. So when I have my hands on a horse, I'm not answering the phone, and if I have my hands on a human, I'm not answering the phone. So text is usually the best way to ask a question or request an appointment.
So we're here with Mary Alice, Dr. Doolittle, working on horses. Tell us about your work on horses.
So I've been I actually started working on horses before humans, way back in 1995.
Just to clear the air, what kind of placebo effect can we expect from a horse?
Zero.
What?
Zero effect, yeah. So when you treat a condition on a horse, what I always tell people is if I massage the horse today or treat the horse today, it might not be a massage, it might be cranial sacral therapy, it might be some neural work. Tomorrow they're not going to trot better to make me feel happy. They're not doing anything to improve my ego at all. They just do better when their restrictions are addressed. So as a therapist, the benefit of working with animals is it makes your listening skills exceptional, and that you have a patient who cannot verbally tell you, I feel that here, or I'm having a problem with this. You do get information from the riders, from the trainers, from the veterinarians, but a lot of times it's a mystery, and so you have to really learn to listen to the body. And they're also very, very honest about, yes, you were on something that's an issue. Often I take my massage students to the barn to watch an equine treatment, and I don't give them a lot of information ahead of time, and they're shocked that they recognize the expressions on the horse's face. They say, I know that face. I make that face when I'm having a relaxation response, or that horse is deeply connected to what you're doing. You can tell their eyes are closed, their lips are quivering, the way they breathe, they shudder through their body, all of that. And none of that is done for my benefit. That is just because they're feeling what's going on with their body. And they like very light pressure, especially around things that are very uncomfortable for them. So it makes your touch really light. And then the other benefit for me as a therapist is I get to be outside, and I get to work with patients who just make me feel better. So
it's wonderful.
Yeah.
So as therapists, we're often in enclosed tombs, and it's nice to get outside once in a while, like normal people.
Yep. So I have some beautiful settings that I get to work in and see the blue sky and watch the leaves blow, and that's great.
What do you see as a hindrance to this? Is it just going to be word of mouth? Because we've had word of mouth for the last 6,000 years.
I think what would be perhaps beneficial for the public is a collection of testimonials, because you can show potential clients research, and for some people that might be helpful. I think it's more of that human connection is important when you say, I had this problem, and this kind of work helped me with that problem, and you sound like you have that problem too, and I recommend this person. I think that is more helpful. So the more client stories we can collect, probably in clients' words themselves, I think that's more powerful, because I think that's why we get the word of mouth, is the client will say, I don't know what it was they did. It feels really light, or it feels really different, or it's not anything that they're used to. I have clients who will say, well, I get deep tissue massage and I benefit really nicely with that deep work. And I'm like, that's great, but this is the problem that I think you have, and if we do the same thing, if I give you the same deep tissue massage that you've been having, this problem hasn't gone away with 35 of those. So if I do another one, it's kind of like the definition of insanity. It's just one more time of having that same experience with the same results. So let's try this really light work. And what I love to say is that the body has no defense with 5 grams of pressure.
Right.
So the body invites you in, and that's the hard thing for people to wrap their brains around, is that something so light and perceptive can be so effective. So that's why I think sometimes they like that kind of felt like magic or something different.
We expect something hard and
Right.
to go through a guard reflex that...
Well, so much of medicine is experiencing pain, right? We're going to give you this shot, and it's good for you. And you're going to endure a little discomfort, while you get a shot. I mean, the other day I had to use my EpiPen. It wasn't exactly a comfortable experience, but I needed it. So it's like you're used to the unpleasant and then a positive result.
Well,
and this doesn't necessarily have an unpleasant moment.
Particularly for men, we love like that stoic look on our face when explaining our pain. Like, wow, that guy, he's such a hard worker. He's such a provider. Look how much pain he's going through. It's like, that might not be the best way to go through life. Understandably, it's pretty smart, to be able to endure pain, but sitting on your couch, watching Netflix, it's time for rest and digest, time for you to recuperate so you can get out there and kick some doors later on. We have Rocky montages where he's, lifting up a log or going through Siberia. That's great. But we don't have montages of him just sitting around and rest and relaxation.
Sure. This country doesn't celebrate the need for rest. And, for relaxation, absolutely. I mean, I tell my students, my clients as well, I like to say everyone has their own recipe. And that recipe for health includes sleep. We all need a different amount.
Right.
Some form of therapy, and that therapy might be massage for you. It might be a combination of chiropractic, acupuncture, and massage. Some neural work. Everybody's recipe is a little bit different. You need some form of strength training or fitness movement. Some form of movement therapy. Some people it's Pilates. Some people it's yoga.
Right.
And you need a form of relaxation. And our culture doesn't teach relaxation. We teach unplugging. So I'm not working, so I'll plug into the television. Or I'm not working, so I'll plug into an activity. I'll go to CrossFit to relax. And that's not the same thing as resting, and it's not the same thing as relaxing. And then the last piece of the recipe is nutrition. And there's so much conflicting information out there about nutrition, and that could be a whole other
That's
discussion.
for someone else
yes,
to
exactly.
work on. I'll bring in a naturopath or some nutritionist experts
But the
to go
point
on
being
it.
that everyone has a different nutrition recipe. There's not one diet for all. There's not one formula for all people. And it's unfortunate that a lot of Western medicine says this is the recipe. It works for this one person. It works for a 35-year-old white male, so let's prescribe it to everyone. That's the test subject for drug trials, is a 35-year-old white male, and that usually doesn't describe too many of us. So.
Right. And you can get into the placebo effect, but you have plenty of people that can do that. Tell me another story.
So sometimes it's a lot of fun when a practicing massage therapist says, hey, I have this client and I just can't get anywhere with them, so would you be willing to come and treat them with me? And I always say absolutely, and so we get that scheduled. And so recently I had a woman who was having sacral pain, and the massage therapist actually had just taken a little three-hour class with me on the pelvis, and she said, I did all the pelvis techniques that you taught in the class, and to great effect. But then it came back after about a week, and so I figured it's time to call you in and see what else is going on. And so the woman was already on the table, so was not able. I didn't feel like I could get her off the table to do a general listening. That's how she was already set up, and she didn't really know so much about what I do. So listened to her sacrum, explained that I was immediately drawn to her coccyx, and I said, but let's treat your sacrum first. She had numeral sacrum restrictions, so I treated that. Treated the sacrococcygeal joint, and then I said, there's more now getting dragged up into your abdomen. So I said, would you mind turning over on the table, because she was face down, and so now she's face up. Did a local listening and was pulled right underneath her left rib cage. And I said, what do you have here? She said, I have a scar where my fertility doctor just went in there to help with a procedure that she's got coming up. She said they go in that way down there. And I said, okay, well, this is part of that. So we worked on it. That surgical entrance had affected her lesser omentum. So treated that. That took us to cecum and ligament of Clayette on the right ovary. And she said, that's really interesting that you're going there, because I've been having problems with that ovary. And I did not know this, and I didn't know that she was a fertility patient. And the really neat thing is that she said in a week, that was when they were hoping to do some more fertility work. So I don't have the follow-up story yet. I don't know if she's pregnant yet, but I'm certainly hoping so. So as we took care of that, felt like there was a little bit more going on in her sacrum and a dural tube restriction, because after a ligament of Clayette was released, got pulled back into the midline. So I did a dural tube traction, which is cranial sacral work. I said, do you remember having a fall where maybe you fell on your butt and hit your tailbone? Maybe you had to like sit on a cushion or a donut when you were younger? And she said, no, I don't remember anything like that. And I said, oh, okay, well, it's fine. So she had a facilitated segment. I took care of that. And then body was clear. So I said, why don't you get up and walk around and see how you feel? I should mention that when I released the sacrum and the sacrococcygeal joint, I had her get up and walk around, and she said that's a big difference. She didn't have any of the sacral pain. She said, I feel something in the right leg, and that resolved when we treated ligament of Clayette. So I had her walk around, and she's like, no, I feel great. She said, my hip feels great, everything feels great. And that weird pull I had in my left abdomen, which I didn't remember that I had until, lesser omentum was treated. So she felt really great. And so then she was like, what was this? So then we had the sweater conversation and talked for a few minutes. And I said, well, I'm not going to, I said, I wouldn't follow up with any of these other organs for another 3 weeks. I wouldn't see it. Minimally, there needs to be at least 3 weeks amount of time for your organs to do what they need to do, and then we'll have this conversation again if these symptoms come back or if different symptoms present. I said, but hopefully by that time you'll be pregnant, and then I said that will limit the amount of visceral work we can do, but we can continue on with your pregnancy massage with the therapist that she was already seeing. And I said, she said, is there anything I can expect? And I said, well, sometimes people have interesting dreams after visceral work because it gets to the brain. And I said, actually, that's one of the ways that we know that the therapy actually has communicated with the brain. And so she and the therapist were talking for a minute, and then all of a sudden she said, oh my gosh, I remember. I remember when I hit my tailbone. She said, I was in pre-K. She said, I was going to sit down on a chair, and the little boy pulled the chair out from underneath me, and I hit the floor. She said, and I didn't tell anybody because I was upset. And she said, and right now I can see the dusk and I can see the color of the chairs, and they're this weird bright yellow. And she's like, why am I remembering this right now? And I said, and there we have it. The messages got to the brain. So it was just lovely that it all happened within the same treatment space. And it was great for the other therapist who actually is enrolled in a Visceral 1 class in a few months.
So the body remembers.
The body remembers.
You smell a certain fragrance in the air. You know this, people, and it brings you back somewhere else. Or someone says something, or that name comes to your ear, and you're somewhere else. And the body has memory, too.
Absolutely. Cells have intelligence, and we store lots of information in lots of places, not just in our brain.
Right. So, Mary Alice, thank you very much.
You're welcome very much.
This is Morgan McGee, Jack's Wholeness. You're going to hire more of these, hopefully. If I get some more of these shy therapists to talk to me. Thank you very much, and God bless.